Welcome to American Academy of Ophthalmology 2025. Imagine. My title is Surgical Outcome of Upper and Lower Lid Retraction corrected by Novel filamentous treated polyester fabric in thyroid eye disease. Author Professor Salil Kumar Mandal and co-author have no financial interest and relationship to disclose. Comes to your background. In thyroid eye disease, orbit is the second most target organ. It is chronic inflammatory orbital disease, autoimmune origin. Females are common victims, and the ratio is 5:1. Patient with TAO clinically hyperthyroid in 77% cases, hypothyroid in 3%, euthyroid in 20%. Lid retraction is the most common finding. In early stage of the disease, lid retraction may be secondary to sympathomimetic responses, and in the latter stage, it may be with the fibrosis of lid tissue. The condition may obscure vision due to exposure keratopathy and also result in psychosocial implications that may hamper the quality of life of the patient. Aim of the study to evaluate the functional and cosmetic outcome of upper and lower lid retraction by using novel filament-related polyester fabric as a spacer material to appreciate the safety, efficacy, and durability of the filament-related polyester fabric. Comes to a method inclusion criteria. All the patients with thyroid eye disease having upper lower lid retraction, minimal scleral show 2 mm in upper and lower lid, limited proptosis less than 22 mm, retraction due to any cause to thyroid patient. Exclusion criteria: patients with DRN thyroid profile, huge proptosis more than 22 mm, significant squint and retraction of ocular movement, thyroid malformations, situated skin disorder. Study design: a prospective interventional study was done with 30 patients through skin approach, LPS plus muscle partial dissection, and resection for the central tarsal and retracted superior to create a similar space where the novel space of FKPF is fixed to the superior part of the tarsal plate by 70 prolonged suture to prevent the LPS reattachment. In the lower lid, through conjunctival approach, the inferior retractor is detached from the lower corner of the tarsal and spacer material is applied. Evaluation parameter: pre and post-operative photograph, pre and post-operative LPS action, corneal center, pre and post-operative marginal reflex distance, MRD1, MRD2, palpebral fissure height, pre and post-operative lid closure, patient satisfaction. Formula applied: measurement of FKP, upper lid, the shape of the semilunar, horizontal length 26 to 28 mm, central wide depends on the following factors. To induce the moderate process, length measured from the surgical limbus is 5 mm, amount of upper scleral show in millimeter, plus extra 3 mm. For lower lid, shape is similar, horizontal length 20 to 22 mm, central wide is 6 to 7 mm, rounded bottle, lateral and medial end is rounded. It comes to results and observation: pre and post of the MRD value. MRD1 value is 6.21 with standard deviation, post of 4.14 with standard deviation. Pre of MRD2 value with standard deviation 7.03 with standard deviation, to post op it is 4.57 with standard deviation. Pre of PFH value with standard deviation 14.3 to post op 10.3 mm. Pre of mid scleral show upper lid is 2.8.21 with standard deviation, and post op it is almost nil. Pre of mid scleral show in the lower lid 3.14 to post op it is almost nil. In the study, 30 AIIMS operated on upper and lower lid retraction corrected by FKPF. Discussion: various spacer materials used to correct the retraction of the fasciculata maxilla of the orbital septum, but the results are separate. In 1990, Conif success is 93%, Hutchison homologous success is 95%, versus passive success is 32%. In our study, success is 94.75%. Rundle et al. Turnover of the septal subject, they made the success rate is almost 80%. The use of spacer material of the septal length with the limiter approach may not be possible in all the patients. In our study, FKP is applicable in all the patients. Lee et al. Suggests that the length of flap determines the formula 2 in degree of retraction plus 2. In this study, we induce moderate doses. Length for it is 5 mm, amount of scleral show in millimeter plus 3 mm extra. Smoking is an art, but it is injurious to health. Follow your hero, but not to follow the art of smoking. Female smokers are very dangerous for the development of eyelid retraction. So stop smoking, otherwise you may have a problem. What problem? Female with known thyroid disease having smoking is more prone to develop Graves' orbitopathy and lid retraction is the commonest clinical feature. All the cases done in the study in the inactive phase of the Rundle scar plotting. New hope, new innovation, lid crease incision made. Tarsal plate and orbital septum is exposed. Central part of the LPS muscle detached from the superior border of the tarsal plate and retracted upwards to create a semilunar space. Novel filamentous knitted polyester fabric inserted into the created space as a spacer material. This is a filamentous knitted polyester fabric which is used upper border of the tarsal plate suture within spacer material by a interrupted suture. So this spacer material prevent the reattachment of the redundant LPS muscle and desired length is cut. This is the first patient in our study operated. After that, we made a protocol on a spacer material. Our protocol is induce a moderate doses. To achieve a moderate doses, length measured from the surgical limbus is 5 mm and scleral show if it is suppose 4 mm plus extra 3 mm. The total length of the semilunar is horizontal 26 mm and the vertical or central wide is 12 to 14 mm. The object is a moderate doses induction. Upward traction suture made kept for 4 days. This upward traction suture maintain the semilunar space between the lower border of the tarsal plate and redundant part of the inferior tract. These are the beneficiary of the patient in our study. Upper lower lid retraction correction by novel filamentous knitted polyester fabric in Graves' orbitopathy. This is the pre-op and post-op picture of the beneficiaries and our series of patients. Thanks for your kind attention. Novel FKPF spacer metal causes not only dangling the lid but also prevent the reattachment of the LPS and the inferior retractor to tarsal plate. Thus, use of cemented polyester suture continuous interlocking in nature, creation of multiple holes in FKPF improves the cost of lid crease and lid height. Regarding integrity and durability of the spacer material, Banksler needs lots of processing before application, but it undergoes desorption and becomes high immunity reaction. Orbital septum flap quickly and screw accepted by the host, but this desired length availability in all age groups is not controversial. Merchant mesh may be causes extrusion. Novel FKP is much superior to other materials. It is 0.6 mm thick, no question of thicker lead in post-op period. As it is polyester fabric, no chance of resorption. As it is tissue pit friendly, it is quickly vascularized due to creation of multiple holes, thus maintain the lid contour and lid crease as well. Lid crease is maintained as well. Comes to a conclusion, novel FKPF in inert non-reactive tissue friendly material. No question of graft failure, thus tissue acceptance is excellent. As it is 0.6 mm thickness, flexible in all the directions. Fabric material, lid thickness, architecture of contour is well maintained throughout the rest of the life. Thus, filamentous knitted polyester fabric is the ideal spacer material for future generation upper and lower lid retraction corrected in thyroid eye disease. After 2 to 6 months post-operative, some patient had a wound healing problem, but though the spacer material is partially extruded, but it is trimmed and resutured, but the lid height is well maintained throughout the post-operative period. Limitation: longer time to wait for the inactive phase of the disease in Rundle scar plotting. Always disease activity is controlled by the endocrinologist to consult. This is my reference. Thanks for your kind attention.